diabetes does not have any symptom for the most part, and so we need to be very proactive.
And unfortunately, when it does get to that kind of advanced point, it's often irreversible changes.
It is manageable, and you can avoid the end stage problems that we mentioned before, but you got to be ahead of the game. You cannot let this invade you and start reacting too late. Hello, everyone, and welcome back to our podcast, Let's Talk Health. I'm Dr. Benheim Albert here at PhysiMed in Montreal.
Dr. Asayag, family physician at PhysiMed.
And Dr. Jan Azule, family doctor at PhysiMed here too.
So this week we're going to talk about diabetes. And diabetes is a real problem that we see in our clinics. It's a serious condition that has a lot of consequences for patients because it starts slowly, and after years of being diabetic, then the patients become symptomatic. So let's dive into this. Let's talk about what you see, in your practice. When do the patients come to see you with diabetes?
So first of all, diabetes does not have any symptom for the most part, and so we need to be very proactive, and we need to look for it. We're not waiting for symptoms. We're not waiting for problems. We need to test to screen, so doing blood tests on a regular basis, checking the blood sugar, checking the A1C, and that's really the key, because if we're going to wait for patients to come in with symptoms, we've missed the boat.
So often enough, patients that are diabetic do not have symptoms. So it's initially, it can be very silent, but as the disease progresses and we have more and more difficulty controlling our blood sugar, and this is why we become diabetic, what kind of symptoms can they start feeling for some of them?
So most patients will usually come in complaining that they are more thirsty, that they're urinating more often. Some patients have some unexplained weight loss. We have patients that are, feeling dizzy, feeling more tired during the day, having issues with concentration. And when we combine them with these other symptoms that are often not so specific, that it really points the finger towards diabetes, or at least some issues with their glycemic control or with their sugar levels.
So we can see that initially patients don't have much symptoms at all. To sometimes some patients can become symptomatic, and you've described those symptoms. But I'll tell you one thing. I saw a patient that came for the first time last week for a medical checkup. And, her main complaint was that she felt some burning under her feet and some tingling, and it was waking her up at night, and she didn't know why. Moral of the story, I found out she was severely diabetic with something called a diabetic neuropathy. So diabetic neuropathy is the nerves at the end of the feet that become damaged from chronic diabetes. So she came to see me with like a really an end stage type of symptoms that we see. So don't be fooled. Diabetes could be asymptomatic, minimal symptoms, or even sometimes severe symptoms. And so it needs to be taken seriously. But can you explain for the audience here, first of all, what is diabetes?
So diabetes is a condition, whereas we're talking about type 2 diabetes, right?
Right.
So diabetes is a condition whereas the blood sugar in the sugar level in the blood goes up, and the body is not able to manage it or to handle it. So typically, you eat, your blood sugar goes up. and then you have, your body produces insulin, and that insulin takes the blood sugar and drives it into the cells, and we use that sugar to function during the day. Now the problem is, over time, if you use your body to a lot of sugar, the body becomes so-called resistant to it. So there's a lot of sugar in the blood. We're producing insulin, and eventually we stop responding to that insulin. So the pancreas has to work harder and harder, make more and more insulin to get to the same effect, and eventually it just gives up, and you see your blood sugar go up and up and up. Now, the problem with that is that sugar is very toxic. That sugar in the blood causes a lot of problems for the organs, for the kidneys, for the eyes, for the blood vessels. And so it's a very dangerous disease.
So essentially, for the audience, and I tell this to my patients sometimes because they don't really understand what diabetes is about, and I simplify it with them. I tell them, listen, in our body, we have different sensors and different thermostat. And the thermostat to manage blood sugar is dysfunctional in your body. That means that this thermostat, which is supposed to be turned on when you have an increased sugar in your blood, somehow is not working properly. Therefore, you're not able to manage the blood sugar that is flowing through your blood. And as you said, increased blood sugar in the blood can be toxic and can have all kinds of consequences. So let's talk about these consequences for a minute. What kind of consequence? Is it just a sugar problem, diabetes, or does it have consequences on other organs? Can you just explain that to the audience?
Yeah, absolutely. So, like Dr. Assayag had said previously, is that these increased sugar levels is continuously circulating in your body and is affecting all sorts of blood vessels and nerves everywhere in the body. The effects of that is that they just don't work as well. Blood vessels get harder. Some of them could even block more into distally, or small ones. And what that means is that you could have impacts on, again, your kidneys. You could have impacts on your vision or on your eyes. Very importantly, impacts in the heart. So those small blood vessels also can start getting hard and not work like they're supposed to, and lead to other problems like heart disease, like heart attacks. There's impacts that are going to have on nerves, and that's a very common one. And unfortunately, when it does get to that kind of advanced point, it's often irreversible changes. And I think that's the part that scares patients for sure. But I think that's the most important thing the most important message to convey during these consultations for patients to take it seriously, is that a lot of these things we can try to fix, we could try to reverse, but when it gets to these really end stage points, there's really not much chance of return.
So just for the audience here and to understand how treacherous this disease is, the number one cause of blindness on the planet, okay, the number one cause is diabetes. Number one cause of heart attacks in the planet is diabetes. Number one cause of renal dysfunction, kidney dysfunction that leads to dialysis is diabetes. Number one cause in the planet of neuropathy, which is a dysfunction of the nerves, like the patient that I just saw for a medical checkup last week, that's diabetes. And number one cause of amputations in the planet is diabetes. So diabetes needs to be taken seriously and needs to be treated properly. So let's talk about treatment for, and maybe just before, patient comes to your office, how do you diagnose diabetes? What do you do?
So the first step, obviously, is to look for the blood sugar, to measure the blood sugar, and that's done through a blood test. So there's two tests that we routinely do. We can check your blood sugar, your fasting blood sugar. So it's the equivalent of checking your blood sugar like this on the tip of your finger. That gives you the blood sugar at this particular time. It could be 5, it could be 6, it could be 7. There's another test that we do now, and that's really become the gold standard for diabetes screening, and that's called the A1C, the glycosylated hemoglobin. And this is a blood test, very simple, that we do all the time, that measures or gives you an average of your blood test over the previous 2 to 3 months. So it really tells me, on average, over the last 2-3 months, your blood sugar has been at that level. And so that's really the best way to know how a patient is doing. And we can diagnose diabetes, but we can also see pre-diabetes. And even before that, you can see that rising over time. And doing these tests, as we said before, early, before patients have symptoms, is the best way to first diagnose diabetes, but also to prevent complications.
So one of the things that is important, measuring your blood sugar in your blood just gives you an instantaneous reading. So if you take a chocolate bar and it raises and the blood sugar rises, doesn't mean you're diabetic. You're just responding to this incoming sugar from the chocolate bar. But if you want to make a better diagnosis is with what's called the A1C, and that's something you do in a clinical office. You can't really do that at home. You can check your blood sugar at home punctually, but you don't have a good idea, at home unless you come to the doctor's office to measure this glycolyzed hemoglobin, the A1C, as you mentioned, which is a better, more reliable screening test for diabetes. So now that we have diagnosed a patient with diabetes, what do you do for them? They come to you, they're diabetic, so what's next?
So, I mean, the most important thing once we have a clear diagnosis of diabetes is to treat those elevated blood sugars and make sure that we kind of control these big spikes and these high sugar levels with the use of medication. There are plenty of different medications that exist for diabetes, and choose which one's the most appropriate based on where their diagnosis is, and if there's any impact on any other organs, or if there's any other diseases or any conditions that are known. The other part that oftentimes is not given as much time, or at least effort, is the changing of the habits, changing of your dietary habits, or changing the way we eat, and changing the physical activity. The most impactful thing that you can do to control your diabetes is weight loss. Is something that we mentioned in the hypertension earlier on, but that this is well documented that for diabetes, just a 5 to 7% weight loss will decrease your blood sugar levels, and will help limit or potentially even decrease and stop certain medication.
So what you're saying is that when they come to you and they're diabetic, first thing you do is you need to control the blood sugar. So we treat our patients with medications, and they do a good job to control blood sugar. But in parallel to that, what you do is you look at the cause of why they became diabetic, and like you mentioned, often enough, we find that these patients are overweight or obese, which induces insulin resistance. Obesity, we know well, induces insulin resistance, making the patients diabetic. So on one hand, we treat them with medication. On the other hand, we try to help them optimize their weight.
Sure.
How do you do that?
So it's very important. It's not, one of the things that I hear often is that, well, this is genetic, right? It's not. It's it can be genetic, obviously, or there can be genetic predispositions, but lifestyle is a big factor. And that's also why we see more diabetes in much younger people right now. We see diabetes in people in their 30s and their 20s and teenagers. Type 2 diabetes, which we didn't see so much decades ago. So, and that's, mainly because of lifestyle, because of sanitarity, because of food and processed food. And so very important to address that. And it's hard to do this. We don't have much time during a consultation, but it's very important to address it. So for weight, obviously we have now medications, those GLP-1 medications, but it's only part of the equation. It's also working with a dietitian to improve someone's diet, working towards moving more and exercising more, and looking at all of these things. Alcohol consumption, and slowly working towards improving the lifestyle, which is really the root cause of the diabetes for a lot of people.
You know, to me, what was the most impactful realization of this in the past, past year or two, is this patient that I had seen in part of the weight loss program. And this patient is a 38-year-old man who, during his first consultation, his first blood test that I did, discovered that he had a diabetes. He had a pretty advanced diabetes. I mean, that he had no idea about. His A1C levels was at 8.5. And in just 3 months, where this patient at the time did not want to start any medication for his diabetes. He knew that he was going to have a very strict and close follow-up. He did not want to start any medications to help with his weight loss either. In just 3 months, was able to completely reverse his diabetes, went down to a 5.5 in just 3 months.
So I'm glad you bring this up because for the audience, we have a very huge weight loss program here at Physimed based on these medications that we have now. But the goal of our program is not the medication, not the GLP-1s like Ozempic, Mounjaro, Wegovy, Zepbound. We use them extensively here. But the goal of our program is to help our patients change their lifestyle. And often enough, when they come to us initially to start their weight loss program, we do a blood test. And often enough, I detect a lot of patients with a high cholesterol count that they had no idea. And often enough, a pre-diabetic or diabetic state, like your patient, that they had no idea. Yeah. So weight control is very important, and we have very effective tools nowadays to help our patients, get control of their weight in a very effective way, and by the same token, also control their blood sugar.
Yeah.
Now, often enough, what I see in my practice is a lot of the patients that come to see me who are diabetic, unfortunately, also have other issues. Right? Often enough, they have high blood pressure, and they have a high cholesterol count. For some of them, they already had some kind of heart attack at one point, or angina, and sleep apnea, that kind of stuff. So, all in all, what we see, it's really a metabolic problem.
Sure.
Right? It's a dysfunction of the metabolism, giving them a series of problems. And yes, medications do help, and we use them extensively to control blood sugar. But we work a lot to make our patients healthier by helping them change and optimize their lifestyle. That's what we do at the office, day in, day out. So, moral of the story, diabetes is a very serious condition. You should not just, ignore it or think that, it's just pre-diabetic. You better be serious about that. Speak to your family physician about it, please, and start taking care of yourself and improving your lifestyle. So it is manageable, and you can avoid the end stage problems that we mentioned before. But you got to be ahead of the game. You cannot let this invade you and start reacting too late in the game. Anything you guys want to mention about diabetes?
Well, I think it's really making it clear that it is important to get yourself checked out, to go get a checkup, to go see your doctor, and to make sure that you invest properly in making those changes. It's not as easy as just having your blood test, taking your medication. I think that the solution is much more, requires for people to be much more proactive. And the way to do that is having the proper team and the proper support around you for you to actually be making meaningful changes long term.
So one last thing before we go, because you mentioned medication. So we see often enough patients that have 3-4 medications for diabetes. Is that for life?
Often it's not. as we said, for in your patient that you were talking about, who was diabetic, he was diagnosed, and he never had to take medications because he really improved his diet and his lifestyle, and he made such a big difference. And some patients are diagnosed much later, or they're much more advanced, and they may always have to have some sort of medication. We may not be able to wean them off of all medication, but one thing is for sure, we often work towards either reducing or even stopping some medications for diabetes by improving lifestyle. And so, and it works very, very well. So patients they don't have to think that they're going to be stuck with their medications and always have to increase the dose year after year. It doesn't mean that we may not be able to reduce everything to zero, but we can definitely make a big difference.
I want to mention something. As a doctor or a healthcare provider, I find it super rewarding when we help our patients become healthier and we help them get rid of these meds. The patients are so happy. For me, it makes me feel great as a family physician that I feel I make a difference for the patients. So on that note, we'll see you in 2 weeks. Thank you very much. And if you enjoyed this podcast, please share it with some friends or some family members. We're on all the social media platforms, and you can find us also on our website. So thank you again. And thank you again for all these positive feedback that we're getting. We really appreciate it. We'll see you in 2 weeks.
Thank you.
Thank you.